So hi, this is Vijay Gautam, and I'm here to present you our presentation on change management proposal. So basically, I'm presenting this to you, both. So this presentation outlines the cultural and the workforce challenges that identified at a large metropolitan hospital, the proposed strategies to address them, and the feasibility plan to ensure the safe and sustainable change. So I will walk you through the background, the initiative itself, and its feasibility, and finally the key takeaway message that we'll be taking through from this presentation. So moving toward the next slide. Talking more about the background and the introduction to the change. What is change management? It refers to a structured process that guides individuals, teams, and organizations from their current state to a desired future state. So, in healthcare, change must be carefully resourced, communicated, and adopted without the compromising the patient safety and quality care. So, frameworks such as the Quarter's eight-step model provide a structured approach by creating urgency, building leadership, enabling communication, securing the short-term wins, and the embedding a culture of sustained change. So this framework underpins the initiative proposed in this presentation. So moving towards the next slide, what is basically my role and the problem at hand? So as a health service management student, I took the role of a planner, analyzing the organizational culture within a 500-bed metropolitan hospital in the New South Wales. And my role included evaluating the workforce data and identifying the risks and designing a fit for purpose change strategy. So the data revealed significant cultural issues. Staff reported favoritism, slow grievance handling, and the poor communication. And also, it showed the low trust in the leadership and the high turnover. So these issues were directly impacting the both staff's well-being and the patient safety, making change not only the necessary but the urgent. So more importantly, the initiative is value driven and guided by the fairness, equity, staff well-being, and the culturally safe practice, ensuring the alignment with the both the workforce and the patient needs. So talking more about the hospital context, so hospital is basically a 500-bed metropolitan facility serving a large culturally and linguistically diverse community. So two critical service areas, intensive care unit and the pathology, were selected as a pilot sites for the initiative due to their high pressure nature and the essential role in the patient outcomes. So staff profile analysis revealed high workloads and annual turnover rate of 19% and the repeated survey feedback highlighting poor trust and the morale of job. And this hospital context forms the foundation for the proposed change management initiative. Creating a roadmap for the change management strategies or the initiative, we can say. So, in summary, in a nutshell, today in this presentation outlines the background and the case for the cultural change. So it will then describe the proposed change management initiative, including the specific strategies and the measurable outcomes. And following that, I will also demonstrate the feasibility of the initiative through the stakeholder engagement, communication planning, and a phase timeline. Then finally, I will conclude the presentation with the home taking messages regarding how this initiative addresses the pressing workforce and culturally issues at the hospital. And the next slide says about what is the problem and the need for this change management initiative. The change initiative was shaped by the workforce data and the staff surveys, which consistently identified the favoritism, weak communication, and slow grievance resolution. Psychological safety was low, and trust in leadership was declining. So high turnover of 19% was compounding the instability. These cultural deficits, the jeopardize both the staff well-being and the delivery of the safe patient care. Therefore, an evidence-based strategy was designed to directly address these critical needs and support a more transparent and the resilient workforce culture. High turnover of 19% jeopardized the staff well-being and the patient safety, making change not only necessary but urgent. So so how the strategies shall be made for this change management initiative. So this is not about the blaming individuals, but about addressing the systemic leadership and the cultural barriers that affect the staff well-being and the patient's outcomes. So the initiative includes two core strategies. First, transformational leadership training combined with the leader rounding and the tire hurdles. This approach builds the leadership visibility and reinforces the fairness and improves the staff trust. And secondly, a peer support program was introduced, providing staff with the protected time to assess the psychological support. So this program aims to reduce the burnout, improve the psychological safety, and promote a supportive workplace culture. And togetherly, these strategies provide balance, focus on the leadership, accountability, and the staff well-being. And these strategies are grounded on the values of equity, staff well-being, and the cultural safety, which from the foundation for the long-term cultural renewal. Moving towards the next slide, which says more about the outcomes and the targets. The initiative sets are clear, measurable targets, and those include the psychological safety scores. Currently, at 3.2, are expected to increase to 3.5 within the 12 months, and the grievance resolution cycle time, now a median of 45 days, will be reduced to 20 days, and then annual turnover, currently at 90%, is targeted to fall to 16% by the end of the year. So these measurable outcomes demonstrate that the initiative is not only strategic but also the outcome driven, ensuring the tangible improvement for both staff and the patients. And moreover, the patient-centered indicators such as the improved patient's experience, service scores, and the reduced incident rates will also be monitored to demonstrate the broader citizen impact. And in addition to staff focused measure, patient centered outcomes such as the improved patients' experiences, scores, and the reduced clinical incident rates will also be tracked down to demonstrate the benefits for the both staff and their wider community. So, what is the feasibility overall? The overview. The success of this initiative depends on the feasibility factors such as the stakeholder engagement, transparent communication, and the stage implementation. A 12-month project schedule has been designed with the pilot units to ensure a controlled rollout and the safe evaluation before the hospital-wide adoption. Evaluation checkpoints, including the dashboards, pulse surveys, and the review kits, are integrated into such stage to monitor progress and allow for the timely adjustment. So this initiative is guided by the values of fairness, equity, staff well-being, and the culturally safe practice, ensuring the change aligns with both the workforce and the patient's needs. To ensure the sustainability, the initiative has a dedicated resource plan. A zero point 0.6 FTE project manager will coordinate the program over 12 months, and three clinical leads will provide the zero point 0.1 FTE is during the pilot phase. And then a training budget of approximately Australian $55,000 is allocated for the leadership development, with the Australian dollar 62,000 for peer support hours, and for the $18,000 for the ICT dashboards and the tools, and for the Australian dollar 20,000 dollar will support the evaluation. In total, the program requires an estimated of Australian $192,500 in the first year, with a 10% contingency. So these investments ensure the initiative is adequately resourced and the sustainable. Now, moving to our stakeholder plan. So key stakeholder will play essential role in this initiative. The executive sponsor, the hospital CEO, will oversee the scope and remove the barriers. The chief people officer will lead the behavioral standards, roster audits, and the policy updates. The director of nursing and the pathology will implement the leader rounding and the civility actions when the pilot units within the pilot units. And then finally, the staff representative and the consumer representative will co-design the policies, ensuring the inclusively and the cultural appropriateness. This collaborative structure ensures both the top-down and the bottom-up engagement. And talking about the communication strategy, the communication will be tailored to the audience. All staff will receive the updates through monthly town halls and the newsletters, reinforcing the purpose of the change and the celebrating wins. Pilot unit teams will engage in daily huddles and weekly leader rounding for the real-time updates and feedbacks. Executives and the board will receive monthly dashboards and the governance reports to track the progress and ensure the accountability. This multi-level communication strategy ensures the clarity, transparency, and the responsiveness throughout the project. Talking about the timeline, the initiative will roll out over a 12 months time period. Months for first to second will focus on the baseline major stakeholder engagement and leadership training. Months 3 to 4 will launch the pilot in the ICU and pathology with the hurdles and the peer support. Months from 5 to 6 will involve the evaluating the pilot, refining strategies and addressing the resistance. And months 7 to 9 will expand the rollout to the other departments. Finally, the months 10 to 12 will embed the changes organization wide, conduct the final evaluations, and develop the sustainability plans. And overall, in conclusion, the hospital is facing the urgent cultural deficits in the leadership, visibility, grievance handling, and the communication. So the proposed change initiative, grounded in the transformational leadership and the peer support, directly addresses these issues with clear, measurable targets, with the strong feasibility ensured through the stakeholder involvement and the phased implementation and the transparent communication. This initiative has the potential to significantly improve the staff and trust, and moreover retention and ultimately patient safety. So it is both necessary and the achievable change. So at the last, thank you all. So thank you for your time and attention. So this concludes my presentation. So I now would like to welcome any further questions for put forward for me. So you may have about the change management proposals, strategies, or the feasibility, or the implements of anything that the queries you pop up. You can just simply ask. Also, you can scan the barcode present here, which contains information about this content. And also, if further any questions needed, you can also email me at my email address. So this is all for the presentation, and the floor is open. I'm ready to answer your queries. Thank you.